Hi, I'm Dr. Milescu. Today we're going to go over the skin model, which will be next week's quiz. I'm a adjunct professor at Daytona State College teaching anatomy and physiology lab. So without further ado, we're going to go over the layers of the skin. Three main layers, epidermis, dermis, and hypodermis. So let's go over the skin model as you can see here. The layers of the epidermis had a few mnemonics out there. Come, let us get sunburned. The one that we came up with in lab, which is fun to remember. Can Lucy grabs Sam's butt? No. So the outermost layer of the epidermis is stratum corneum. There are no live cells. This is dead skin. This is the layer that has the keratin that protects you. So that's the stratum corneum right here. Then underneath that in thick skin, which is palms and soles, you're going to have stratum lucidum. So can Lucy, right? So stratum lucidum is the next layer. And then beneath that is stratum granulosum. You're going to see a lot of mitosis going on, a lot of nuclei, if you're looking at a histological microscopic view of a skin sample. All right, so under that, can Lucy grab? So stratum granulosum. Sam was stratum spinosum. And then the deepest layer was stratum basal. So that's everything you need to know about the layers of the epidermis. You have specialized cells there, melanocytes that produce the pigment, and various other cells that we talked about in lab. But I'm strictly going over the skin model here so that you're able to identify come you have lab next week. All right? Now, deep to that is the dermis. So the dermal layer is PR, and we remembered Puerto Rico. So the uppermost layer of the dermis is called the papillary layer. You could see it as little waves, looks like little ocean waves here. That's the papillary layer of the dermis. The rest is all reticular kind of tissue, so reticular layer. All right, so what are you going to identify here in the dermis? The nerve receptors here, okay, the nerve endings, see that nerve? The nerve endings that are at the top layer of the dermis are going to be called Meissner's corpuscles. And then the deeper ones for deep pressure, so to feel the sensation of pressure, is Pacinian. So you could see it right here. All right, so this kind of looks like a little tennis racket. And when you open it up, it's got little layers. Okay, so that is Pacinian. Now, what is this little round structure surrounding the hair follicle and hair shaft? That would be your sebaceous gland. Your sebaceous gland releases sebum and contains that oil to specific areas of the skin and hair so that your skin and hair is not dry. Then, in order for you to get goosebumps, you have this specialized muscle here called the erector pili muscle. This whole area here is called the hair follicle, and inside is the hair roots. And you also have vein, artery, and nerve, so you have innervation of it. You have vasculature providing blood supply to it. All right? Then this coiled up looking structure that looks like a little snake coiled up, and then it comes up like this. That is a sudoriferous gland or sweat gland. And you have eccrine and apocrine glands that release sweat. So that's your sweat gland. All right? So we went over pretty much everything that you need to know in the dermis. You're going to see a variety of nerve endings throughout the dermis. And the upper layer, as I said, is Meissner. Down here is more Pacinian. All right? What else are you going to see? You're going to see vessels sprinkled throughout the dermis and the hypodermis. So the hypodermis is my final layer that I'm going to discuss. Fat in a van, that's how we remembered it. So adipose tissue, and you have vein, artery, and nerve branches and tributaries across the hypodermis, as well as the lower layers of the dermis, which you can see cross-section of vessels here. And they come all the way up and provide blood supply all the way up to that papillary layer of the dermis. Okay, so that's all you have to know regarding the skin model for your quiz next week. Make sure you go over the PowerPoint, and I will see you all in lab next week. Study hard.